It's Sunday the 28th of April, the end of my first week of treatment, and it's really, really nice to have 2 days off and not have to do the trip to Cambridge and back. I've had a few side effects already, dry mouth and literally hardly any saliva causing that, and also a loss of taste, which I'm missing the most. So things like chocolate just don't taste like they used to. We're trying to look at things that we can buy this week that have got more flavour in them, that are different, that will hopefully give me a bit more pleasure in eating. But I think it's something I'm going to have to put up with. But I've got a general kind of dull taste in my mouth constantly. Also tiredness, definitely feeling more tired. I don't know that's because I've had lots of broken sleep because of the tummy tube or because of the radiotherapy. It's hard to tell. An impact of the chemotherapy is I'm nearly getting constipation now, very close. I'm taking a laxative to try and combat that, and I may have to up the dose. But I don't want to get to the point where I can't go, because that's going to give me even more discomfort. In terms of skin, no issues at the moment, and I'm using this Aveeno moisturiser, which I was recommended, to help with the skin and to get using it early before I have any side effects. In terms of the tummy tube, I felt a lot of discomfort in the 2 days after the operation, but I know it's worth it and it's well worth putting up with. But it was like hard to sort of work out how to lay. Laid on my back, snored a lot, which obviously meant my wife had to go and sleep somewhere else. I've now got to the point where I can sleep on my side a bit, which is good because that's my favourite position. But I have also had to sleep in the chair down here on the sofa. But I have been sleeping, so that's good, even if it was broken. The tummy tube itself is a bit like a feeling of being punched in the stomach, but it's also like having a knot in your stomach. And it's made me feel anxious, although I believe it's fake or somewhat fake, but it kind of puts me on edge. It doesn't last all the time, but it's certainly there at various points, and it somewhat stops me feeling positive about things just for a short while. But it is improving. Each day we have to clean it, and they sent us home with a pack with a cleaning fluid and a cream that we have to apply. We had a nurse come do it on the first day, and since then my wife has been doing it, which is good because I feel a bit funny doing it myself, but I think I'll probably get there. But at the moment it's been a bit odd. And the first day I had it done was very strange. When the nurse did it, she said, "Where do you want to be?" I said, "I'll stand here." She said, "No, I think you should sit down." Yeah, it was a good idea because I came over all sweaty, fainty, and nearly threw up. So good advice from her. We also have to flush it twice a day, and we have these syringes. That's obviously to keep it clean. So that's on my update from week 1. Next week's obviously going to have its other sets of challenges, but it's okay so far. So thank you for watching, and I'll see you in the next episode.